So, welcome to the Kanski lecture series Cornea part 20, and it is going to be the last part of the Cornea chapter 7, congenital anomalies of the cornea and the globe, microcornea. So, basically, cornea that are basically the congenital problems of the cornea. Microcornea, in which the cornea is smaller in size than the normal cornea. The normal neonatal corneal diameter is 10 millimeter, and the adult diameter of 12 millimeter is usually reached by the age of 2 years. Microcornea is a rare autosomal dominant, sometimes sporadic, unilateral or bilateral condition in which the horizontal corneal diameter is less than 10 mm or less over 2 years of age, or less than 9 mm in the newborn. So basically, in a newborn, the cornea diameter is about 10 millimeter, and by 2 years it is 12 millimeter. So how we diagnose this? If the cornea diameter is less than 10 millimeter in 2 years of age and less than 9 millimeter in newborn, it is known as microcornea. The cornea is deep on keratometry. There may be hypometropia and a shallow interior chamber, but other dimensions are normal. Ocular associations include glaucoma, angle closure, and open angle, congenital cataract, leukoma, persistent fetal vasculature, coloboma, optic nerve hypoplasia, aniridia, and nanophthalmos. Systemic associations have been reported. Refractive error and amblyopia should be managed appropriately. So basically, if a patient has a microcornea, it has a small cornea, so angle can be narrow. When the angle is narrow, it can cause the glaucoma, and there may be other associated ocular problems, like eye is going to be most likely small, so you can always think about hypermetropia, and there can be a leukoma, corneal opacity. There can be a fetal vasculature, optic nerve hypoplasia, aniridia, and nanophthalmos. So we will discuss nanophthalmos later. So you can see figure 7.69a and b. It is showing a microcornea, B microcornea, and corneal opacity with a dense cataract. So what is a microophthalmos? Microophthalmia is a condition in which the entire eye is small with an axial length of at least 2 standard deviation below the mean for age. So basically, in the microophthalmos, the eye is going to be normal, but only its length is going to be very small. It is going to be less than 2 standard deviation, uh, less than 2 standard deviation of the normal for that age. Simple or pure microophthalmos, which is a nanophthalmos, refers to an eye that is structurally normal apart from a short length and a complex microophthalmos to eyes with other feature of dysgenesis, for example a coloboma or orbital cyst, and a range of other ocular abnormalities. It may be unilateral or bilateral. When unilateral, abnormalities may be present in the fellow eye. Vision is variably affected in conjunction with the severity. It is typically sporadic, but mutation in numerous genes have been implicated. Around 50% of the cases may be associated with systemic abnormalities, including the CNS. Potential environmental causes include fetal alcohol syndrome and intrauterine infection. So, one important thing: fetal alcohol syndrome and intrauterine infection. So, basically, what a microphthalmos eye is, basically, eye is going to be having a short. That eye is going to be short, but it can be associated with small complex orbital features like coloboma or orbital cyst, and it is usually sporadic. Nanophthalmos. In nanophthalmos, the entire eye is small with an axial length of less than 12 millimeter. So if the entire eye is small and there is an axial length of less than 20 millimeter, it is going to be a nanophthalmos. Always remember this. Both eyes are usually affected. Ocular association include glaucoma, especially angle closure, as the lens is large relatively to the size of the eye, hypermetropia, ametropia, amblyopia, and strabismus. So one thing, when the eye is small, the angle is going to be crowded. It is going to have an angle closure glaucoma, and there will be the short length, so they're going to be hypermetropia. And other features are, it can have an amblyopia and ametropia. Childhood management of the refractive error and amblyopia are critical. Surgery for glaucoma is particularly hazardous and can result in a big in aqueous misdirection and choroidal effusion, small eye, big trouble. So very important that in a patient having a non-ophthalmos eye having glaucoma, when you are doing surgery, there is a increased risk of malignant glaucoma and choroidal effusion. Lens extraction is technically challenging but has the advantage of deepening the anterior chamber and reducing the refractive error if a suitable high power lens implant is inserted. So you can see figure 7.7a is showing a microophthalmos. You can see the left eye is smaller than the right one. B is showing the left microophthalmos with bilateral iris colobomas, and C is showing a right microphthalmos with a cyst. So there is a cyst in it. Anophthalmos. Anophthalmia refers to a complete absence of any visible globe structure, though microphthalmic remnant or cyst may be present. It is associated with other abnormalities such as absence of an extraocular muscles and a short conjunctival sac and microblebron. Causative factors are probably broadly similar to that of a microophthalmos. So anophthalmos, there is no visible globe, but you can see a remnant cyst with it, and there can also be a extraocular muscle deficiency and a microblebron. So you can see a bilateral simple anophthalmos, and B is showing the anophthalmos with a remnant cyst. Megalocornea. Megalocornea in the cornea is going to be large. Megalocornea is a rare bilateral non-progressive condition that is usually X-linked. So what is very important? X-linked condition. X-linked. So it is going to affect the male. Approximately 90% of the infected individuals are male. The adult horizontal corneal diameter is 30 millimeter or more with a very deep chamber. There is a usually high myopia and astigmatism but normal corrected visual acuity. Lens subluxation may occur due to zonular stretching and pigment dispersion syndrome may occur. Numerous systemic associations have been reported. So in megalocornea, it's going to be the opposite of the microcornea. They're going to be myopia. They're going to be lens subluxation, and they're going to be the astigmatism. Sclerocornea. Sclerocornea is a very rare, usually bilateral condition that may be associated with cornea plana. Sporadic cases are common, but a milder form can be inherited as autosomal dominant and a more severe form as autosomal recessive. Usually in eye diseases, autosomal recessive is usually severe, but autosomal dominant is a little bit of less severe. Peripheral corneal opacification with no visible border between the sclera and cornea confers the appearance of the apparently reduced corneal diameter in mild to moderate disease. Occasionally, the entire cornea is involved. Basically, there is no differentiation between the cornea and the sclera. So, 7.72 showing the clinical appearance of the megalocornea, and 7.73 is showing the sclerocornea moderate. A is showing moderate and B is showing the severe form. Cornea plana, it is an extremely rare bilateral condition in which the cornea is flatter than normal. Cornea is usually a little bit of globular in shape, and whereas in cornea plana it is going to be flat. The radius of curvature is larger. There is a corresponding reduction in refractive power resulting in high hypermetropia. So what is associated with cornea plana? It is going to be the high hypermetropia. Two forms are described: corneal plana 1, CNA 1 being milder than cornea plana 2. Associated ocular abnormalities are common. So, charactactasia. Charactactasia is a very rare, usually unilateral condition thought to be the result of intrauterine keratitis and perforation. So, what is happening? There is going intrauterine. There is an inflammation of the cornea and perforation. It is characterized by the protuberance between the eyelids of a severely opacified and sometimes vascularized cornea. So there is will be the ectasia of the cornea, which is opaque and vascularized. It is often associated with raised IOP. So you can see figure 7.75 showing the keratoconus. Next is showing the posterior keratoconus. Posterior keratoconus is a sporadic condition in which there is a unilateral non-progressive increase in curvature of the posterior corneal surface. So it is a unilateral condition and it is a non-progressive. Increase in curvature on the posterior corneal surface. The anterior surface is normal and visual acuity relatively unimpaired because of the similar refractive indices of the cornea and the aqueous humor. Generalized involvement of the entire posterior corneal surface and a localized paracentral or the central posterior indentation types are described. So there are two types: generalized and localized. In localized, there is a paracentral and the central posterior indentation. So you can see posterior keratoconus. In posterior, there is a slightly increase in the curvature in the posterior side of the cornea. So that's it for the cornea chapter 7. We will see you in the next lecture series. Thank you very much.